Have you ever wondered about the colour of your vaginal discharge? Well, no need to worry. I'm Dr. Jaunbocus, a practicing GP in the UK, and I will cover all about it here. In this video, we'll dive into what's considered normal and when things might be out of the ordinary. I'll also share some tips on home treatments and when it's a good idea to contact your doctor. Recognizing a shift in your vaginal discharge can undoubtedly stir up some concerns, right? I've had the privilege of consulting with many women about this topic, and it's common for them to get a little anxious when they notice any alteration in their vaginal discharge. There's often a fear that it might be a sign of troublesome, sexually transmitted infection, or even something cancerous. It's crucial to understand that every woman's vaginal discharge is unique and can change throughout her menstrual cycle. This variation is perfectly natural. The key is getting to know what's typical for you so that you can quickly identify when something seems off and get the help you need. Okay, so let's look at different discharges we ladies can experience. White or clear discharge. It's normal for a woman to experience a daily white or clear vaginal discharge. As long as there's no other accompanying symptoms, there's nothing to worry about. In fact, throughout your menstrual cycle, you may notice changes in the texture and consistency of your discharge. For example, during ovulation, it may become more slippery and resemble egg white. This actually helps with the fertilization process by making it easier for sperm to reach the egg. Have you ever noticed a thicker white discharge? Similar to cottage cheese, along with itching and irritation in your vaginal area? If so, you may be dealing with a vaginal yeast infection, also known as thrush. The good news is this is a very common condition and can be treated with antifungal pessaries, creams and oral medications, all available at your local pharmacy. However, if you're experiencing recurrent thrush infections, it's important to contact your doctor to determine the underlying cause. Yellow or green discharge. Okay ladies, this is not normal. When I see yellow-green discharge in my patients, the first thing I worry about is a sexually transmitted infection or an STI. Trichomoniasis is one of the more common sexually transmitted infections out there, and it's caused by a little troublemaker called Trichomonas vaginalis, TV. This sneaky parasite can be passed between partners during sex, especially when you skip the condom. Here's the thing. Trichomoniasis doesn't always announce itself right away. It tends to make its presence known about a month after you've been infected. So, what should you watch out for? Well, that greenish yellow discharge might remind you of a frothy science experiment. Plus, you might catch a whiff of something fishy down there. Some folks also report a burning sensation or discomfort when weeing or pesky itchiness below the belt. But here's the problem. About 50% of people with trichomoniasis don't experience any symptoms at all. They can unwittingly pass on the parasite without realizing they have an STI. Scary, right? But don't worry, there's some good news too. Trichomoniasis is pretty easy to treat. You need a short course of antibiotics, usually metronidazole, and you'll be well on your way to feeling better. The second possible sexually transmitted infection, STI, presenting with yellow-green discharge is gonorrhea. Instead of your normal clear discharge, it appears as a thick yellow-greenish discharge in contrast to the thinner, frothy discharge with Trichomonas vaginalis. If you've got gonorrhea, you might experience some uncomfortable symptoms like a burning sensation or stinging when you wee. Your nether regions can also feel a bit irritated. And for some ladies, there might be irregular bleeding or spotting between periods when they are infected. Again, gonorrhea, like trichomoniasis, doesn't always cause symptoms. About half of the women who get gonorrhea won't show any signs, so they might not even know they have it. So, if you're having unprotected intercourse, you could unknowingly be passing this infection. The good news is gonorrhea is treatable. A course of antibiotic can usually clear it up. Red or pink? So let's talk about something that's normal but might raise a few questions. The red or pinkish discharge. We all know that time of the month when you start noticing a faint pink hue in your vaginal discharge. It's like nature's way of giving you a heads up that your period is on its way. That pinkish tinge is just a tiny bit of blood mixing with your regular discharge. As your period gets closer, this pinkish hint might become a bit more noticeable because you know the blood flow is gearing up. Here's something else that might not be as familiar but is okay too. At the end of your period, you might notice a brownish tint in your discharge. Don't worry, it's not something to be alarmed about. This happens because the mucus sometimes traps some old blood that has had time to change the colour. It's like nature's way of wrapping up your period. This brownish tinge should go away soon on its own, so there's no need to stress. Your body is just doing its thing. Now, it's normal to notice a change in the colour of your discharge around your period. But when it happens between period, it might raise some eyebrows. That's where you need to be more cautious. Picture this, you're going about your day and you suddenly notice a shade of pink or red on wiping. No need to panic, but it's what we call spotting. If this happens around the time you're expecting your period, but your period doesn't fully show up, well, we need to think about the possibility of something big, like pregnancy. That slight pink discharge might be a sign that a fertilized egg, now an embryo, is trying to snuggle into the cozy lining of your womb. If that's the case, it's time to grab a pregnancy test. I've already made a video covering some of the other early pregnancy symptoms, and I'll pop a link to this somewhere around here for you. If you experience bleeding between periods, paying attention to what your body is trying to tell you is essential. This unexpected spotting could be due to a hormonal roller coaster, a sneaky STI, or even some inflammation in your intimate parts. In the worst case scenario, it might be a rare hint from your body about a potential concern like cancer in your vagina, cervix, or womb. I'm not here to scare you. Please do not sweep this under the rug. If you've noticed any pink or red surprises between your usual period, it's time to consult your GP or gynecologist. Grey discharge. If you ever notice a greyish discharge, it could be a sign of bacterial vaginosis, also known as BV. It's usually associated with a fishy smell that can be quite alarming. Alongside this change in colour and fishy smell, you might observe that your discharge becomes thinner, even watery. BV occurs due to an overgrowth of bacteria in your vagina. It's more common if you're sexually active, have recently taken antibiotics, or have performed vaginal douching. Don't do this. You might be tempted to use strongly scented soap and fragrance to mask the fishy smell. Don't. Strong soaps can further encourage the growth of these unpleasant smelling bacteria. If you're dealing with BV, know that you're not alone. Approximately 1 in 3 women will experience this at some point. The good news is that BV can be easily treated with antibiotic tablets, gels, or creams prescribed by your doctor. We've covered a lot of topics today. I've included timestamps in the description if you want to revisit a particular segment. Hopefully you now better understand what is considered normal and abnormal, and as well when to seek medical advice. Remember, if you notice any unusual symptoms such as funky green or yellow discharge or anything else concerning, please schedule an appointment with your GP or gynecologist as a precaution. It's always better to be safe than sorry.